Hey everyone, welcome back to the channel. Today we're going to talk about a rare but devastating neurological disease called Krabbe disease. Krabbe disease is also known as globoid cell leukodystrophy. And even though it's rare, it teaches us something very important about how the brain works and how fragile the nervous system can be. This disease mainly affects infants, but it can also appear later in life. What makes Krabbe disease especially tragic is that it causes progressive destruction of the nervous system, leading to severe disability and, in many cases, early death. Krabbe disease is a genetic disorder. It's inherited in an autosomal recessive pattern. That means both parents usually carry the gene without being sick themselves. The core problem is a deficiency of an enzyme called galactocerebrosidase. Because this enzyme doesn't work properly, a toxic substance called psychosine starts to accumulate in the brain. Psychosine is extremely harmful to nerve cells. So instead of being broken down, it builds up and slowly poisons the nervous system from the inside. To understand what happens in Krabbe disease, we need to talk about myelin. Myelin is a protective insulation that surrounds nerves. It allows electrical signals to travel quickly and efficiently. In Krabbe disease, psychosine destroys oligodendrocytes, the cells responsible for making myelin. As a result, there is severe demyelination. The damaged tissue fills with large abnormal immune cells called globoid cells, which is where the disease gets its alternative name. Without myelin, nerves simply cannot function properly, and the brain gradually loses ability to control the body. The most common and most severe form of Krabbe disease is the infantile form. Symptoms usually begin between 3 and 6 months of age after a period of apparently normal development. There are also juvenile and adult onset forms, which progress more slowly, but these are much rarer. The earlier the disease starts, the more aggressive and devastating it tends to be. The symptoms of Krabbe disease are heartbreaking, especially in infants. Early signs include extreme irritability, excessive crying, poor feeding. As the disease progresses, children lose developmental milestones. They may stop smiling, stop making eye contact, and stop moving normally. Other symptoms include severe muscle stiffness called spasticity, seizures, loss of vision, loss of hearing. Eventually, the nervous system becomes unable to perform even basic functions. Diagnosing Krabbe disease requires a combination of clinical suspicion and laboratory testing. Doctors measure galactocerebrosidase enzyme activity, which is very low in affected patients. Genetic testing can confirm mutations in the galactocerebrosidase enzyme gene. MRI scans typically show extensive white matter loss, reflecting widespread demyelination. In some countries, Krabbe disease is included in the newborn screening, which is crucial because early detection can change management. Unfortunately, there is no cure for Krabbe disease. However, if the disease is detected very early, before symptoms begin, a hematopoietic stem cell transplant may slow progression. This treatment does not reverse damage, but it can delay neurological decline in some cases. Most care is supportive, focusing on comfort, nutrition, seizure control, and quality of life for both the patient and the family. The prognosis of Krabbe disease depends on the age of onset. For the infantile form, the prognosis is poor. The disease progresses rapidly, and many children do not survive beyond early childhood. Later onset forms progress more slowly, but they still lead to severe neurological disability. Thanks for watching. If this video intrigued you, don't forget to like, subscribe, and join me next time as we uncover more mysterious of medicine. See you next time.